I often see couples where one partner has cancer, and the question that they ask their partner in my office is, how can you still want me? Look at what I look like. You know, I have a part missing, my breast is gone, or I have this great scar down my abdomen, or I'm so thin, or I've got all the swelling. How could you possibly want me? And my question at this point is to the affected partner to say, look at your mate. Does he or she look the way they did 5, 10, 15, 30 years ago? And this question is often greeted by laughter. Well, none of us look like the way we did 10, 20, 30 years later. Most of us have gained a little bit of weight, lost a little bit of hair, got some wrinkles, some sagging. And so the person with cancer will often laugh at it and say, of course not. He's gained 40 pounds, he's bald, he's got hair sprouting out of his nose and out of his ears. And I say, do you love him any less? Do you want him any less? And I'm greeted with the answer, of course not. I love the essence of him, or I love the essence of her. And yet these people cannot grant themselves that same grace. So we often have totally unrealistic expectations about ourselves. So let's talk a little bit about communicating with one's partner. What are some strategies? And obviously what I'm presenting to you today is not the encyclopedia, but I have a few little pointers that I think might be helpful. Talking to someone that you love, to your intimate other, is often the most difficult thing that you have to do. Talking makes us vulnerable. It makes the other person vulnerable. The stakes are really high. It is way easier to talk to a professional, objective outsider than it is to talk in a meaningful way to the person that you love most, because you don't want to hurt them. So, one of the first things is, don't have these conversations about sex and sexuality in the bedroom. It's an emotionally laden place. Have the conversation in the kitchen or somewhere else. Always talk in I statements. Don't make statements about what you think your partner is thinking, feeling, or experiencing. You can only talk about yourself. Talk for yourself, about yourself. And most importantly, take time to listen. One of the tried and true sort of counseling things that we will often do is actually have an object, and the person who holds the object gets to talk. The other person doesn't interrupt while that person has the object in their hands. So grab the salt shaker, and while you have the salt shaker in your hand, you get to talk, and talk until you've said what you want to say. You will have another opportunity to clarify. It may be helpful to have an objective third person, such as a social worker or counselor, to help you talk, to ask those probing questions that perhaps you are afraid to ask or your partner is afraid to ask. And often having that objective third person in the room does lower the sort of emotional level of the conversation. Don't be afraid to cry. Yes, it's frightening to be vulnerable, but your partner wants to help. Your partner wants to be a part of your life. And just think about how good you feel when you can help someone you love. So let your partner help you. Now, what if you need to find someone to help you and your partner negotiate this? What if you don't have a partner but are having feelings or have questions about sexual functioning, about how you feel as a person? How do you find a health professional to talk to? Not always easy, and I'm very respectful that in some places this is going to cost a lot of money. I know that here in Winnipeg we have marital and family counselors, for example, that charge $150 an hour, and this often is just way out of reach for many people. Start at your local cancer center, or start with your family physician. Your local cancer center should have social workers on board who can provide some services in this area. If you are really lucky, they will have someone who has additional training in sex therapy. I regard myself as a sexuality counselor. I just prefer the language, and I think it's a little less scary sometimes for people rather than sex therapy, which for some people have some additional meaning. But I certainly work with social workers, and we work together. My expertise is not in marital therapy. My expertise is not in relationship counseling. It's in sexuality counseling. So I will work in tandem with a social worker. So speak to people, your oncologist, the nurse who works with your oncologist, or a social worker. Talk to your family physician. Many have an interest in this area and may be helpful to you. But I am absolutely aware, particularly in rural areas, that this is much more of a challenge. What's really important, though, is to identify that you have a need in this regard. Something that I see here in my practice at Cancer Care Manitoba, and something that has been clearly described in the literature, is that the healthcare provider is quite willing to talk about this topic. However, we want the patient to identify the need, because first of all, we're all people, and we come from where we come from, and some of us come from conservative families or very religious backgrounds and don't necessarily find it that easy to talk about sex. So, that's the first thing that you need to be aware of. So very often the healthcare provider doesn't want to ask because the healthcare provider doesn't want to be seen to be weird in any way or nosy. So we wait for the patient to identify the need. The patient may want to talk about this, but they have those same sort of cautions and wait for the healthcare provider to ask the question, because patients figure, well, if it's important, my oncologist, nurse, radiation therapist is going to ask the question. The result is a deafening silence, and this is one of the reasons that I wrote my textbook, Breaking the Silence on Cancer and Sexuality, and it's certainly the reason for the title. There is a deafening silence that ensues when the healthcare provider is waiting for the patient and the patient is waiting for the healthcare provider. So ask. Now, every now and then you will get a response that you do not expect. I will never forget meeting a woman. She was a woman in her 60s who came to see me, and I asked her how she found me. It was very soon after I started my practice here, and she said, well, I was seeing my oncologist, and I told my oncologist that I was having some sexual problems, and he took 2 steps back, hit the door, found the door handle, and ran off down the hallway. The nurse saw him running out of the room and came into the room and said to me, what on earth went on there? I saw Dr. Smith, running very fast. And the patient then explained that she had asked, had wanted to talk about this, and this was the response of the oncologist. He found a way he didn't find a way, he just left the room. So sometimes you may find that the person, the healthcare provider, reacts perhaps with shock. They may blush. My attitude always is, they need to get over this. But certainly it's really important to identify that you have a need to talk about this. There is a very helpful organization, which is the American Association of Sex Educators, Counselors, and Therapists. They have a website, www.aasect.org, which has a list of certified counselors and therapists. Most of them, however, are in the United States, although there are some in Canada who would be listed there. But, talk to your family physician, talk to social workers, talk to nurses. There is probably somebody in the cancer center or in the healthcare system where you live who has an interest in this. And hopefully they have the integrity and honesty, if you ask a question that they don't know the answer to, that they will go and find the answer. And one of the places that they can find the answer is in my book. And I will now end the commercial segment of my presentation.